It's the election race that hasn't had as much attention. The race between John Hogan and John Abbott to become the next Premier of Newfoundland and Labrador. Both candidates for the Liberal leadership were in our studio on Wednesday. Here's some of the highlights.
At nearly $20 billion, we have the highest net debt per capita in Canada. When oil was at its peak, we spent big money expanding civil services and boosting salaries. Now, Churchill Falls could bring in $1 billion a year. So, Mr. Abbott, would you legislate limits on how that money can be spent to help knock down our debt? And if not, how much of a priority is debt reduction to you?
The finances of the province are in, I'll call it, reasonable shape, but we do have very high debt and we've continued to run deficits. So the additional funds that will come through the MOU with Hydro-Quebec, $17 billion over the next 17 years, plus more, obviously, billions more to come. So it is a good opportunity for us to, and I've already have said this publicly, is to develop a plan so that we, in actual fact, can retire our debt over the next number of years. It'll be, till maybe 20 plus years that we can do that. But we can do it. The first thing we have to do, though, is stop running up further deficits. And that is something I am committed to.
And so that economic spinoff, along with all that cash, will really help us develop a plan and stick to a plan where we don't have deficits in the future. And in fact, we continue to put money away, which this government has already done in our future fund. And then we can access that fund if and when it's necessary in the future. But if the funds come in through Muskrat Falls, we can, or through the Churchill Falls deal, we can maintain that future fund and have it continue to grow in the market. So there's opportunity there. And certainly we do need to be responsible with the money. But when we talk about priorities like healthcare and education and affordability, finalizing and developing the Churchill River is our biggest and best opportunity to do that.
The rents are so high, the taxes are so high, and it's just, it's depressing sometimes that, you are not even sleeping well, you have to do so much work.
It's not sustainable, and if something's not done soon, I think things will get a lot worse.
I'm actually moving out of my apartment right now just because of rental increases, right?
Really?
So yeah, just going back to actually help my parents sell their house and try and, get something on the go with them where we can kind of share a 2-apartment house just because we're both, kind of tight for money, and I feel like everyone around is, right?
Those of us who have better incomes can manage, but we're finding the scrape of it all as well. You hate paying more than you think it's worth.
There are measures already in the budget to help people with affordability, such as the gas tax reduction. But what else can you offer people who are struggling to keep up?
I know one of the individuals talked about living in a home with his parents. Part of what the Health Accord looks at is making sure that seniors can stay in their communities, but they might not necessarily want to stay in the houses where they live. Their children have moved out. We can get those seniors out into smaller houses, but they can stay in their communities, and that will free up affordable housing for other people in this province. And that's something that I'll certainly look at and make sure is done if I'm Premier of this province.
One of the programs that is quite successful right now in the provincial government is the rent assistance program for families who are low incomes, who are struggling with their rent. We need to expand that program. We need to expand what we're doing in terms of home repairs for seniors. So again, to keep people in their own homes, in their own communities, but they need financial support. So the government, with its $10 billion plus budget, needs to reorganize some of its finances to make sure we can focus on their needs. Because without doing that, these issues are only going to get worse for the individuals we heard from.
A lot of money in the healthcare system, but what more is needed to fix the healthcare crisis?
So right now, one of the biggest things, of course, is access to a family physician. And the reality is we don't have enough. And we have to make sure, and that's true across Canada as well, and we need to expand our seats at the medical school so that we can train and graduate more doctors. We need the same for nurse practitioners. So that's the reality. We don't have enough. So in the meantime, how do we address that? So my role then as Premier will make sure we hold the Newfoundland and Labrador Health Services to account for improved outcomes. We know how we can compare with other provinces, and we do poorly on many fronts, and there's no reason for that.
People still are struggling with health care, and everybody doesn't have access to primary health care, and emergency room wait times still are a little bit too long for people's liking. The trends are going in the right direction, and we need to continue to focus on those trends. Almost 80,000 Newfoundlanders and Labradorians now have access to primary health care through a family care team. It's a concept that didn't even exist a couple of years ago. Those numbers are going up each and every month. More surgeries are being done than pre-COVID. Emergency wait times are going down. We're integrating our road and ambulance so that rural and remote people who have emergency health situations are going to be picked up and transported to the necessary facility to make sure that they have treatment. So the trends are in the right direction. There's still a lot of work to do. It's not about money anymore, but it's making sure that we stick to the plan.
It's up to the 14,000 or so Liberal members to make that choice. The decision is going to be announced on May 3rd. CBC will have live coverage.